Good morning, our dear viewer. Wasuze Otia. I thank God that we are alive this beautiful morning, and I'm glad to be with you this morning. We glorify God for His providence of life. It's a blessing. Gwe okulaba amachago nako olwaleero. I believe you know that. So tebaza Katonda kwanti atukkiriza ne tubeera mu show ey'olunaku olwaleero. Ya me and you nango muweerezaawo JOVET BIRUNGI. Tubeera ffenna buli lunaku. That's Monday to Friday, 9 a.m. to 10 a.m. Gatuyiga. Ate era nga wetunyumira. I told you this is the show that gives you that balanced diet you need in your morning. Today is a Tuesday and we are about health. I call upon you people and everyone there to join in and we'll learn together. So social media platforms kwe tulinyo, tuli live ku YouTube. Otega mu kutana Uganda bango twegattako wonna wooli nobanga watching a show no. Go TV tuli ku 820, sometimes tuli ku 241 and video tuli ku 21. So kwaza remote yo otwegattako watana twegattako ate gwa twegaseko wumuza remote yo oberenga oyingira televu mu byokuyiga. This month tubadde ku female genital infections era nga tuzze nga tulaba topics ezenjawulo ezigwa mu infections ezenjawulo ezigwa mu female genitals, and today so I was like we should stress more about this particular topic because Yadimu field she's receiving a lot of people, and this topic should be touched and should be addressed as much as possible. We are neglecting it nayenga abachala jankizo nyo okubanga tu tegeera our lives beyond about this topic of cervical cancer. Kubanga sinungi eri obulamu bwaffe nga abachala. So we're talking about the cervical cancer this beautiful morning, and I request you not to go any far. Just sit and enjoy the topic. We are with our doctor as usual for this whole month, Dr. Eleanor Nakintu iranga aina Edwardo Midland Health Care, and we are glad to say that she's impressed. She's having a lot of appointments. People are inquiring a lot. People are willing to inquire. People are willing to know their health through this program, and we are so glad. We are glad for me and you to make an impact in your life. And today we are going to talk about cervical cancer with our doctor again, Okubanga Atunyonyola. So, you're welcome.
Thank you for having me. Good morning.
Good morning.
Good morning, our viewers. Mwasuze mutya era mwebale kubeerako ku channel.
The other time I talked about cervical cancer nenkugamba bamuso mutwaleyo ku screen, mutkoleyo ka session ka free screening. Kwanga walayo fe munange. Bitaga okumanya obulamu bwabwe. Nayenga kyonchikulekedde. We want to know more about cervical cancer. Abachala chituyisa bubi. I was driven by the fact that one day naliyo mu ddwaliro grade B and TB, if it's okay to talk about it. A lady came mukulukulu nayenga she is having cervical cancer. Oh my God, the room was unbearable. Yes. It was unbearable. So when you talked about it, I was like, nah, I think it's the best time we address to it.
Thank you very much, JOVET. Never enough abatuwuliriza mwebale nnyo okubeera ku program yaffe ya Me and You. JOVET kyogedde kituufu. Omanyi Uganda abantu bagala nnyo free healthcare services. Tebettanira nnyo kugenda mu ddwaliro kubakebera. Naye ndowooza ebyabakyala bigenda bikyuka. Naye ogenda okulaba nti bano atunda akalagala kamu kekawonya nabuguma kigalanga bichi ne babiyayanira nnyo. Naye ate nagenda mu saloon ne bamugamba enviri mitwalo 15 n'asasula
immediately.
Nagenda mu ba herbalist namugamba mitwalo 8 okujja mu ekizimba n'asasula. Naye okujja mu malwaliro kizibu simanyi lwaki bannayuganda tetukyetanira nnyo. However program eno ya Me and You ogenza okwesanga nti abakyala bawuliriza ate nga their mind is changing. N'olwekyo mbeebaza nnyo naddala abakyala bebasinza okuntuukirira. Kino kirina okukyuka naye olangira nti tulina ka free service obala bonna badduka until waliwo emergency ng'afunye ekizibu ddala nga alina bubi awo n'alyoka ajjukira okujja mu ddwaliro naye kino kirina okukyuka tubere nga twettanira okujja mu malwaliro. Yes.
So kaviri buli mwezi.
Yes. Kaviri mitwalo 14 naye ng'emitwalo omusawo agamba n'okujjako omusayi mitwalo 3 n'aba complaining this morning actually I was chatting with the general manager wa Sikea. She's a very good friend. Nga twogera ku healthcare seeking behaviors what is happening Sikea is all over there doing very well ngamba chichi what is happening how is that trend are people coming neda twesanze trend ye abantu babera babetani okujja ko ngafunye emergency bagenda okutuka mu ddwaliro nga it is late. However this morning when we talk about cervical cancer twagala tutekesera ku prevention because by the time you have cervical cancer ngoyo go walaba mu grade B it is too late.
Yeah.
So what is cervical cancer? Kokola omwa gwa nabaana. Abasinga wabagamba omwa gwa nabaana tebategera omwa gwa nabaana kyeki baloza waliwo omumwa oba omusajja wayingira gwe mumwa nedda. So tuyina nabaana nina ekifaananyi kyenakuwadde kisobola okutuyambako okunyonyola omwa gwa nabaana oba kino kye bakugamba awali ekigambo cervix twagala tunulire nomo nawana wali cervical cancer nawali cervix nabana tugira ba uterus wanawali cervix wewe omumwa wano webakebera musawo nagama muno kati tubuzayo centimeter mmeka wewe gula bwewat
ngogenda okuzala
baby nafuluma wawali ekigambo cervix twagala tunle size ne wali nomo wewe gula gwego mumwa gwa nabana so sina bana yonna nti efunye kokolo nayo mumwa gwa nabana awo the mouth awe gula nti wetugenda ne tukebera netugamba nti olinawo centimeter mmeka 5 okyagenda okyakaaba nnyo
that moment.
Yes, so that is mwagwa n'abaana awo kokola omwagwa n'abaana wakwata kyekimuleta akawuka bakaita HPV human papilloma virus tulina HIV human immune virus naye kano bakaita HPV human papilloma virus yeleta okokola omwagwa n'abaana ebiseera ebisinga over 80% ke kawuka ako akawuka ako kali sexually transmitted. HPV is the most common sexually transmitted infection. Twayogera ku infection guno omwezi netugamba virus tujazogerako olulala. So when we talk about cervical cancer, HPV is the most common sexually transmitted disease. That means abasajja bakalina
nebakatusiiga
nebakabasiiga nena bakyala bakalina
naffe tubanako.
Yes, HPV erimu obuuka nga bibiri 200 different types of HPV. Obuuka HPV type esinze okubeera associated with cervical cancer. They are mainly like 4 or 5, mainly 2. Naye research is ongoing. Only 2 types. Shiringa onogamba mbusenyiga alina obuuka bungi nnyo kati nyinza okuba nakawona nenzija wano nentula nawe nga gwolina ka virus akala nekankwata oba kale kiringa we twayogera ku Candida. Candida ekitawanya nnyo nti tawona amanyi okukyuka leero alina amagulu n'omutreatinga enkya nakyuka n'abeera muntu n'akoma otagenda so HPV has different over 200 types. So it is the one that causes cervical cancer. Agenda kuchi ali sexually transmitted. So when you're in a sexual relationship, okay, you are prone to getting cervical cancer. HPV can also be found on skin. So skin to skin, you can get HPV. Oral sex, HPV is found in the mouth. Okay, oral sex. So you can transmit. Those who do those kinds of acts, you can transmit it to someone. And that is why we say that
you can even fetch it from someone.
You can fetch it entirely. Okay, that is why we say that condoms, unless ringanga ovlo is not entirely 100% protective against akawuka kano aka HPV.
Kote karinga sire mutekaitamu.
it is not entirely protective chechenga because neku skin to skin condom kasobola okubeerako. So it is anywhere, okay? So that is what causes cervical cancer.
So right, we are ku UTI infections the whole of this month.
Yes.
The infections zomuntu ngafuna recurring teziwona straight titobola kumetera ku cervical cancer.
Thank you very much. So the question you're asking is what are the risk factors? Risk factors okufuna akawuka kaka HPV tetugenda kwogera nnyo ku cervical cancer nga tunategera akawuka kano. Age of sexual debut wotandikidde okwegatta n'omusajja early. The earlier you start, because everyone over 99% everyone eyegatta, you must get HPV. Kwa gambye webaka bakabera ku skin n'abasajja babeera nako, you must get it. So early age of sexual intercourse, that is the first predisposing factor. Multiple sexual partners. Alina basombi alese, that is a predisposing factor for HPV. Okay? Smoking is a risk factor. We shall talk about why it is a risk factor for cervical cancer and HPV reinfection. Okay? So and then of course okuberanga you have a familial history ebyo bijja bwe bityo naye nga ka virus kaliwe kabakaze
tebiri mu binombo mbo anyo tugamba even okubantu omuntu okulwala ekibumbo, I think about it's a myth. It's hereditary nti bajaja barwalanga ekibumba kati kubuka nti kisoboka nti cervical cancer yaliyo mu biseera ebyo nawe nejange mutikata mu mulimu cervical cancer, or it's just a myth.
It is a myth. It's a myth because as long as you're sexually active, whether yalwala or teyalwala, you are going to get HPV. Now here is the game. Here is where the tire is hitting the ground. HPV can clear on its own. You're going to get infected as long as your immunity is strong. Kajja kolachi kuvamu. Kajja kukolachi keyoza koka. Ne kavamu mubiri nga onogamba nti ofunye lusenyiga senyiga onywedde habo, then it goes. Because it is a virus, it will go.
Now we are starting
cervical cancer okumutegeera. So you've gotten the HPV, it has gone. Okay? You get it from another man, brings it to you, it has gone. Why do you get cervical cancer? To Gambia, over 200 strains. There are few strains that cause the cancer. It is going to come to your cervix. Egenda akawuka kagenda kujja kunaba nayo, that strain is very strong. Kagenda kujja kumwagwa nabaana. Kagenda kusanga nga you are not strong enough, your immunity is not good.
Weak.
Your immunity is weak. It will not clear. Kajja kusigalawo. Yes.
Kafune ebirungo.
Another one comes. It comes chronic infections. Obaka is clearing, then it comes again after 5 years. Kaberewo. So it is recurrent infections with HPV type that is going to cause cervical cancer. It is going to be recurrent. Waliwo nekirala nti omwala nga avubuka. Omwala nga avubuka. Amabere buli kimu kigeja, reproductive system egeja. Membrane eri munda mu cervix munda nayo egeja kubanga bigeja. So ekiri munda kifuluma wabweru kubanga everything is expanding. You're exposing it to the, first of all, it was created to be inside. Kati okuze, it's being exposed outside kubanga ovubuse to the acidic environment of the vagina. Once it is exposed, actually cervical cancer watandikira weewo enyama evudde munda nebeera exposed. It is bigger than we think. We better exposed to the acidic environment of the vagina. First of all, ebadde munda katonda yagiteekayo munda naye okuze kati evuddeyo eze kungulu. So the acid, it is not supposed to be, it is interacting with the acidic environment. So the cells change. Ziba nyangu okola ki okubeera attacked. So HPV comes, attacks those cells. And you're not strong enough. Either your immunity is low, banafa baina HIV, they suffer more. Research shows. Beba singo kwera ne cervical cancer, yes, n'abalina sukali. As long as your immunity is low, cervical cancer ayangu kola ki. So akawuka tekabera cleared, ne kabeera okwo, ne kakula.
Nyinza okutegeera nti no ndebanga I'm showing cervical cancer signs sensible of noticing.
So, unfortunately, you will not know. By the time you know, it is too late, and that is why we are here. To create awareness. Wayogedde ku kigambo kya sexually transmitted infections. Remember, when you have an STD, wali kumwagwa nabana, it is there sitting. Akawuka wekajja, it will not go away. Jukina kugambye nti kamanyi okweyuza if you're strong and your body is there. You're going to get gonorrhea, you're going to get a chlamydia infection. Twayogedde omuntu wa bulijjo ategera discharges ezo za green eziwunya biki nga STDs. It will not go. Akawuka tekajja kugenda, kajja kusigalawo. Kakule, kaliye, jukira ennyama evuddeyo kati eri fragile, kaliye. Okay? So you will not know that you have it. By the time you get to know, it is too late. Now, this is where the car starts rolling. We hit the ground. Now we are rolling.
Roll it.
What do we do? Screening. The reason why we are here today, JOVET, is okugamba bakyala okwettanira okukebera kubanga akawuka kana ka HPV we katuko kulwaliza it's over more than 10 years katuulo mo ne katuula sebo oyikayinza okumala emyaka 10 okay nga wali cells zikyuka nenga katudde kali omu myaka 10 yes
ekitegeeza telling out that nandibanga I am developing candidiasis. Kwanga I am seeing that the normal is becoming abnormal.
Yes.
You can never see a sign until now you are developing cervical cancer.
Kati, by the time you see the signs, I want to repeat this. Ogenze mu stage indala because it has many stages. 1, 2. For tuba to screening and tubagamba mujje tubakebere tukebera 1 ne 2. We get it from there. What are we doing at 1? Otugamba nti 1. Kitegeeza cells ezirifunye HPV ezitandise okukyukakyuka. Tuzirabi. Out treating it. Tonnatuuka ku stage 3, 4 eya cancer yennyini yali full blown. I recently, can I continue? Or
yeah, you continue.
I recently, nabadde n'omukyala, I think around 3 weeks ago, yazze kumujjamu, she's 50 years, 50 years, azze kumujjamu muki kaweta. Ngamba, musawo kati bino na kyazaala, period, nenga periods agwaddi 2 years ago, naye kati njagala kunzijjamu kaweta. Nemugamba, fine. Kakati, ngenda okebera. Akaweta nga sina nawe kayisa kukajjamu. Ne mugamba, how are you feeling? Nagamba, adjusting, ndowooza akaweta kano kandeetedde obuzibu. Naye ngenda okebera. Kubanga tukebera, mumanyi that thing, kye bateekawo kirina omwango ogw'embaata, speculum, twesa olulimi olwa bulijjo. So, mba ngenda bwe nti, okugaziya okugenda kumwagwa n'abaana, I had to just come out. Ne tusooka ate ne tunyumya ebirala, because incidental finding, yabadde tamanyi. Nenga it is bad. She was 50. So yajja ku birala ne tusanga ebirala. Era abakyala basinga bajja for family planning. Wesanga nga you just want mbadde nsaba kola ki njagala kukebera oba kaweta sisobola kuteekayo kaweta nga si kutestinze. Because you can't know. And what are we testing for? Cells ezo ezikyukakyuka. Ezitandise okukyukakyuka tezigenda ku bleedinga. Tezigenda ku bleedinga, tezigenda kuluma, tezigenda kuleta discharge naye akawuka kali omwo kalya. Nkugamba emyaka emeka? 10. You have 10 years. Oyina emyaka 15 okukwata akawuka nga tekanafuuka full blown. Because we otandikira okufuna symptoms ezo nti bleeding tugenda zoogerako. Oli ku stage ndala nnyo ate.
My dear, it takes us back to check up. Check yourself, prioritize your life. Whether a man, whether a woman, prioritize your life. Nga ogenda for akavidi ka buli mwezi, it would be better no banga you go for a checkup. At least, someone is going to tell us how long should we go for checkups, because life should be taken care of. We are still going on with our doctor. Tovao.
the journey of 25 years. Gakominalo Mogo Kutano Kumipirabini Metano, Kumaza's Day, Auditorium Plaza, Ginger Road, which is in Chirico Post Bank. Barikidwa Kwaza and Dalaniji, Jambo to Alizekum Kama, who is about to Zokumanemia Kabini Metano. The Kanisa Nasingo Kretaba to Abanjiba Kwangulia Sedume Wembusi, Okinga Kwamtwari Nechundu, Emtoro Kumi, 9 million number Yemeza, Emilia Tigrosa, Kago Gwemisana, Gabiwa Gitwa, Treasure Land High School Kalaji, Musa Power Steering and Autopata, Light College Katikamo, Windsor Junior School, Fairmont High School, Most Fashions, IKK Modifications, Rooney Quality Tires, Olma Construction Company,
One Touch Records, Light Nursery and Daycare, Watona Engineering and Investment, Canon Electricals, Mama Mutesa Beauty Saloni, Seda Construction Company, Bamubiru Electronics, Midland Schools, Buntabaneka Wempe, Bakabobo Cosmetics, Morrison Junior School,
Prime Radio, Ne Hope Channel Uganda, Okumanyi bisingawo, 075 nya, bili mwenda, 0 mwenda 0, era bitegekeddwa, Kings and Queens Events.
Vision Trumpet Choir kuvechamu na Machibia District bakutusako. Tetulina kupondoka mu maka concert. Nomunano gwa mukaga 2025 ku House of Rest Auditorium Fido Dido. Jamhuri n'amalobozi agatali mu bikwakwaya ne music omusenekerevu okuva mu Vision Trumpet Choir okuyingira omutwalo gumu n'emitwalo 2 VIP emitwalo 5 emmeeza akakadde kamu sawa 8 zennyini nga tusumulula. Vision Trumpet Choir werekeddwako Gabriel Ministries, Levite Choir, Gospel Light Crescendo, Galilee Code, Inspired Moments, Blessed Harmony, King Herald's, Puritan Ministries, Onyx Ministries, Hope to Heaven, Revelation Troop, Seeds of Peace, Delset Ministries, Basingo Artists nga Bossa Paul, Maso Mia, Jeje Nyombi, Ganafa Chistu John ne Uncle John. Tosubate tulina kupondoka mu maka concert ne Vision Trumpet Choir nga munano gwa mukaga ku Fido Dido.
Do not miss.
What are the best investment aspects that Uganda has?
You build apartments, maybe let's say you buy land in Chanja at 100 million, build apartments around 500 million, then you sell to someone at 1.4 billion.
The treasury bond and maybe the bill, how do those two things work?
Treasury bond, usually we see that it is 2 years and above. Okay? So it is more days, and we see that it attracts a less interest rate, more interest rate or return. Usually find it at 14% return, 15%, sometimes it goes even up to 17%.
Omuzadde anoonya essomero erina abangula omwana wo mu magezi ag'omutwe n'ebyomwoyo nkwanjulira Outspan Day and Boarding Primary School Gayaza Namulonge. Ssomero lya mulembe nnyo liva ku Nassale paka ku kibiina ekyomusanvu abawala n'abalenzi. Liri ku musingi gwa kkanisa y'Abadiventi. Endabirira y'abaana nnungi n'ebyokwerinda biri gguluggulu. Lisangibwa Namulonge Gayaza Zirowe Road. Era okuwandiisa abayizi abapya paka ku kibiina ekyomukaaga kugenda mu maaso ku ssomero. Okumanya ebisingawo noti 782 322 ne noti 772 376 887.
Welcome back from that short commercial break. Yeah, we are glad to be with you again. Gwache kumiddeko oliwa kabinyo. Let me use the youthful language. Oli mutufu ate oliwa kabi. Thank you so much okwagala Hope Channel Uganda. Ate program ya me and you okwantu ojitega no watchinga. Thumbs up. We glorify God. We are into the topic of cervical cancer. Mwabakotega tako tutabire dala nti having multiple sexual partners is one of the root cause. Abavubuka bannange zakyali muvubuka. Are you committed? Are you abstaining? Obulamu bwo bugagga bwo. Those who say, me I use condom, it even goes on to the condom, it goes into your hands, that virus, HPV. So teweeyibala ng'olowooza nti you're protecting yourself, you're exposing your life to risks. Ate mwe abaana b'obulenzi muli mu kutambuza bulwadde eri abaana b'obuwala. Please save life, love your life, and when you love your life n'abalala obafaako. So love yourself, prioritize your health. So tukatinzize mu ddwaliro lyo onkebedde nga kasaviko kansa mwali. How kubanga kiva mu buteekebeza for all along. Kagenza okukula for those 10 years nga kakuze. Biki ebivaamu nga tebisanyusa omuntu bayitegedde okwefaako very fast.
Okay, thank you very much. Kati otegeera otya nti ekkubo lino olitandiseeko litandise okulya. Jjukira omwezi guno tubadde twogera ebintu bino nti neibawo n'akola atya n'akola atya. Ebintu bino bimanyi okufaanagana. So twayogera ku bleeding. Omumwa gwa nnabaana ogwo jjukira nkugambye gwe guyasama bwe guti bebi n'avaayo gulina emisuwa. Kati jjukira kuliko amabwa. Buli kabwa kagendako bleeding. Post-coital bleeding oba kye tuyita okubleedinga nga mwakamala okwegatta. Maze okwegatta n'okebera siri mu period, siri mu ki?
But you're seeing blood.
Yes. That is common. Kati webajja mu ddwaliro abasinga tugamba UTI. Bali abatamanyi channel ziri nti tezifaanagana. Agamba UTI namwa antibiotics oba
ombe akuza.
Oba nagamba oba namuteekerawo ekirwadde ekirala. Nejjukira tulabye omumwa gwa n'abaana guli. Okay? Go bleeding. So bleeding oba toli mu period no bleeding. However, always tekako however because omusawo wakebera yaba amanya. Oyinza okubleedinga nga on your family planning. Oba ng'oyingono gwe yajja kagondi kam bleedings. Nenga sina nangeri kinga una wakuta walinga cabbage. Nenga mchala mukulu odi tamanyi. So bleeding, post-coital bleeding abavubuka omala okwegatta abafumbo and you see some bleeding, okay? Tochitwala nti kya bulijjo. Jangu omusawo akebera. Oyinza ogenda n'ogamba ngenda kugula habo, but abatunda habo naye nze njagala nnyo to emphasize this point. Yes, in the future, robots and artificial intelligence zijja kuba zitutte ekifo kyaffe, but for me, yes. I believe in looking there. Okay? Ojja nenkugamba nenkuze gamba kandabe. Okay? So that is where the game is looking. Kubanga wendaba ngenda kulaba ebintu bingi. Ntandikira kungulu paka wentuka wali
ngenda kulaba. Katono kumbo ogenda okulaba nga birala.
Yes. So that bleeding can have so many causes. Then discharge twazogerako. Eno ne tugamba tujja postponing. Now we are here. Cervical cancer can have a discharge of all types. Masira, water. Gayinza okubanga mazzi. By the way, gayinza okubanga mazzi ga bulijjo. Gamba amazzi ga bulijjo. Naye nga mazzi gakuyitamu. And yet you don't know. Why? Because bucells obwo obukyuse bulya. Ate bugenda bu affecting abunabo. Remember, cancer is cells zigenda za affecting, and the body is now not able to fight off the HPV infection. So
you begin doing all those
watery discharge. It can be water, it can be the other discharges we talked about. Jukida immunity already ekended the wali wabadde gonorrhea, syphilis kumumwa gunafuye. Okay, so all those discharges come olusubira masira. Okay, najana masira namira ka flagell, and yet we don't know. So for me as a gynecologist, you come to me ngoli mukyala era mujenga mwetegese sigenda kuwandiikira ddagala.
You must first know.
Oyinza okutya okujjamu musonyiwa olulimi luno kubanga yembeera yaffe gye tulimu. Oyinza okutya okujjamu akawala ako naye kansa aluma okusinga that little time. Jogambye omanyi kansa aluma n'okusinga egyo emitwalo 3 oba 2 oba 4. Ena gyogamba nti ngenda gulamu habo ba neweeyo bakoleki bankebere. Kansa aluma nnyo because it's going to affect your children, affect your family, your relatives. So you have that discharge. It is smelling. It is smelling. It can be smelly, and then you say this is just an STD. However, I said we look.
To make conclusion,
yes. Okay. And chensanze yes abasawo banja abakyala bamine kati nga bannaffe aba Islam abatali comfortable with the male abasinga kale ajja n'omwami we.
That's better.
Ajja ne wobanga otya jangu ne shake Jagu shake tuberewo kukebere mukyala munno. Oja abakyala tugenda kufa. Nga tumira tukozesa habu atabudde ate n'okusonsekayo. Basonsekayo tamanyi kwasonseka kirya kyeyongera byasonsekayo byeyongera kuleeta more infection. So you will bleed, you will have that discharge, it will smell, you will have pain. Twayogera ku pain. That pain can be low abdominal pain of like a PID, urine pain when you're urinating. It can also kujanjaba UTI, but cervical cancer will cause pain when you're urinating. Swollen feet. Why? Because wabanga atandise oku expanding avudde ku mwagwa n'abaana kati agenzeko mu n'abaana jukira o neighbor kawago waliwo ureters ziri ezigenda mu kawago ezigenda mu kidneys so awo wonna kati they are blocked ziri blocked so when they are blocked eno wagulu you get pain kubanga kidneys ziri zijudde omusulo tewaliwe guyita it is painful so kidneys are affected, you get high blood pressure, and you get ebizimba, okay? You get ebizimba, no massaging, and each massaging at touch tegeda one. Constipation. Akantu kali njagala nnyo tuberenga tukajjukira. These people are neighbors. Omwagwa naba nemabega, you will get constipated. Fibroids will cause constipation. Endometriosis will cause pain when you're passing stool.
These are sisters.
They are neighbors. Okay. Now, when you go to cervical cancer, it is starting to spread. It will cause constipation. It will cause pain. It will cause blood in the stool. Jakwera no musai mububi agambe ebiwuka kamire albendazo. Nenga tumanyi twaliwo akasuwa akavudde wano kumagwa n'abaana ne ka communicating ne kajjako eno katandise okuyiwa negwe nga tokimanyi ofunye pain bakuwadde UTI guno omwaka myaka 2 nfuna pain UTI kati ate guli omwaka that's how they come bajja mdwa nagamba msawo kati omwaka gwali bweguti webitu webyatandika naba ku bisimu mbamanyi
soma kale nemba ngafuna obuntu webuti
nali nkyakola wamaze kachima emyaka ndoza kajiweza 8 okay ate kirungi kati from experience abakyala mbagamba nnyo nti twogera ku simu naye when you come tubeera n'obudde kwedda kikazo 3 nonyumiza byonna kubanga biba bingi okay so kayinza okuyitamu
obyetaaga gwe okudrawinga conclusion yes
ne kayitamu then you have musai mustool nolowooza nti then you have back pain tujogeddeko because the kidneys are infected kidneys they are compressed omusulo gujjudde waliwo omukyala yajja ne pain mondira agamba ina pain mondira tugamba okay tukole scan kubanga era kizibu okumanya aho ya nenga waze wotandikira so when we did a scan netulabanga the kidneys zinge ziriko mass tugamba naye wasemba dio kola scan nganda ba kidneys kuliko kamas nagamba ndudde nga zinnuma nokufuka olusi omanya abakyalo lusi waliwo abamu ayogera kamu nokufuka olusi no nga kuntawanyiza ddala naye gye byaggwera mu Uganda Cancer Institute omusawo nankubira nangamba naye doctor omukyalo ono tewamukebera cervical cancer amanyi we learn with experience twagenda okwesanga it was the primary cancer yatandikira ku cervix naye lwakuba ajja ne story kidney zinuma scan emugango gunuma biki naye nga ne bankuyagamba you know patient wogo watwereza this is it kati ng'omusawo owulira nti you have not done justice owulira and that is how we learn nogamba no woman kuva ne leero bonna I must check kubanga oyinza okuba ne cancer liver kubanga spreading natambula kidney nagenda ku liver lung cancer
ava ku cervical cancer na spreading anagenda mu bitende ebira
yes so atandikira okubanga kidney awo waliwo ureter au okumpimpi awo atandikira no mugongo back pain nabera bla back pain ng'omuntu omulumira ddala kumbe it is spreading naye nga tachiraba kwajukira kuva buto yabera ne discharge zitandika ku myaka 13 discharge nga so that is normal okay so newesanga nti even other cancers tutandikizza zizalidwa nenga tochimanyi okay yes
msawa you know we are more into preventing
yes
because we don't want to reach the point of managing it when I'm already having it before you tell me how to prevent it So I want you to guide us into the prevention part of it. And then after you drive us into kati omuntu omukebedde nga mulina the management part of it.
Okay, thank you very much. As usual, I tell you that prevention is starting from here, me and you. Me and you, we are now preventing by telling them this is there. You may be having
info,
it.
yes.
So prevention starts with you, awareness, telling you. And then we go to the next phase of prevention is the primary care. Go for screening. Screening zirimu ebika bingi, how to screen. So waliwo webateekako akalagala, webakuteekako akalagala tugiyita V&A, bakuteeka akalagala cells ezo zitandise okufuna enkyukakyuka nga ziri really affected by HPV ne zitandika okukyukakyuka n'oziraba within 1 minute ng'otaddeko akalagala, then after omusawo ajja kusomera results. Nakugamba, you know what, you have these cells that are changing. Ebiseera ebisinga bakyala bagamba nina cancer oba tonnaba oba olugendo olutandise. If you don't pick those cells at that point, okay, they are going to change.
Was speaking asobola okuwona?
Yes, they treat. So batekako either cryotherapy. The treatment is complicated, but either batekako cryotherapy okunyogoga ennyo cells ezo nezifa nezikunkumuka nezifa you bleed like for 3 months kubanga bazisse batekako ekinyogoga oba ka thermocoagulation we have it at Midland Healthcare netuzocha still webazocha ezo cells ezikyuse they come out, they bleed off obera ne bleeding yo naye ng'omanyi nti I am preventing something worse. Another type of testing is the HPV DNA. Katino WHO yagamba, World Health Organization, it is the best test. HPV DNA ne bakebera DNA ya HPV musayi. But you know how much a DNA test is? DNA okujjako nga ddala okikakasa nti ono omwana siwane weewayo sente.
Why would you go for it?
So kiyinza ffe mu sub-Saharan Africa oba kale mu Uganda okubeera a little bit expensive. Yes, wali ababikola ebitongole abadde ebikola aba USAID bavuddemu sente tezikyaliwo abadde babikola research. So but it is very good. So abalabi baffe, those who can go for HPV DNA specifically ne bakebera ezo DNA HPV, it is there. WHO says it is the best. So then they get it. Now, here is the game. So if you come to me with results, see, the HPV DNA, I still have to look there.
But why should I go for that thing? You have to look
because the mass is full blown. Kati ngono mchala yajja sisobola tetusobola kujja ngamba before we even remove the IUD nina kusoka kujjako kanyama kukasindikawa mu lab. Then lo and behold, it was cancer. And then we have to remove the uterus and do all those things. So another way of testing is the pap smear. Luli ebadde musayi HPV DNA eriendala yabadde yakuteekako kalagala kulaba cells ezikyuse kati tulina pap smear. Pap smear bateekamu akabrush ne kabrushinga cells eziri munda ne bafuna nakala ne bajjako cells eziri kungulu ne bakakebera okulaba oba cells ezo zitandise okufuna enkyukakyuka. Kyoyogedde ekikulu nnyo nti prevention is where the game is, and prevention is screening.
Even if taken by
screening. You go for screening. Ogenda mu malwaliro ne bakuscreening. Another of prevention is the vaccine. HPV vaccine. Akakaiso ke bakuba abaana ab'emyaka 9 ebweru bakuba abawala n'abalenzi.
Tunga bakatyambo kandi nga kalimu ebirala.
Tujja kuleeta wano abakama bafa aba Minister of Health bongera okukitangazaamu. Ekyo nagambye sigenda kitangaaza kubanga waliwo abakugu baakyo. So lwaki bagema abawala myaka 9 ebweru bageba n'abalenzi myaka 9 myaka 10 why tusuubira nti abatannatandika kwegatta so nokagemeraawo so that when it comes kasanga already omuntu alina they can fight it off. They can fight it off. So vaccination, however, there are new studies nti ne woba okufunye eki ofunye or turns already sexually active. There are types of vaccines. That is now a different topic. They can vaccinate now even when you're 45 years. They can vaccinate. Even when you have had HPV, they can vaccinate. So each type of vaccine has its own role. And that is a topic for another day. However, vaccination is also a way of preventing it. Okay? And then also, for the men, because you can say having multiple sexual partners, multiple sexual partners. Okay, so protect yourself, abstain if you should. you know, and live a good life. Take care of yourself.
Love your life.
Love your life. Towenyiga mu bikolwa ebiri risky, high risk behavior. Tiwali ekivulu. Ngenda kupakinga condoms zange. Okay, you may get something worse. Then those this one I should talk about, those who get involved in anal sex. We've had girls who get involved in anal sex. Mary Stops hires me to go and do screening in Muslim countries, Niger, French-speaking countries. So some of those cultures, anal sex before you get married. Even those who have had anal sex, neighbor.
It's close. Your neighbors.
We had an incident in Zambia hospital some time back. We had a 20-year-old with stage 4 cervical cancer. So they say screening, since akauka kukamala emyaka 10 nga kaliawe kajawe kagenda until it is now there tekagenda kuvaawo. So they say that usually screening should start at 21. Ministry of Health, Uganda, 21 years to 45, others to 60 years. So guidelines keep changing. However, when we got that case, Yali, I think 20 years old with stage 4. So what do you do? Nze nsaba abachala akakisa konna kofunyo gende w'omusawo genda yo talk. You never know what is there. Njukira nagamba patients don't read books, they don't read guidelines. Jakubeera ne guidelines izo naye ate osanga ye ekirala nga this is off, completely off. Tewakisoma tekibaddeyo teri akimanyi. Okay, so screen and screen, vaccinate, live a good life. Live a good life and love yourself. And smoking, those who are smokers, never ya smoking ako. Nicotine oyo mubi. Nicotine nga yagenze kumwagwa n'abaana. Ne wonokola otya HPV tasobola genda. Yes, it loves nicotine. So abaina HIV, so we say they screen every 1 year. Why? Because their immunity is low.
Prevention.
Those who have diabetes, we also prefer buli mwaka baina sukali.
Screen.
Yes, kati ababulijo depending on the type of screening method you have used. Woba kozesa HPV DNA bagamba myaka 5.
Okay.
Nenze in my facility nkozesa visual inspection with that medicine. Okay? If I have seen, then I treat those cells, then you come back maybe 6 months for review, then I give you 3 years to come again. And usually I send reminders. It's automatic. You just get a reminder that it's time to go back for your screening. Pap smear, 3 years. Pap smear is all over. Vaccination, Marayoga government. Then you can vaccinate.
That is nice.
Yes.
So management, part of it.
Yeah, management of cervical cancer. It is technical. So yes, it's very technical. Okay, chemotherapy. However, the step, it depends on the stage where I'm quoted.
Okay.
Katuoja walo ojanga netutekako akalagala and the cells change. Neno labanti dala cells zichusa nenga wanene nga ne onotekako that medication, that therapy, thermocoagulation or cryotherapy. No, it is not going to cover. Then we go into lip. Tukozesa masanyalaze. You connect and then you cut.
Oh God.
You cut off that area. Why? Because at this point we say it is early. It is spreading. It is better that way than to leave it. Yes, so it is called lip. Lip is also quite common in Kampala. We do it. So no salako. Alus no kola kon. No kola kon. No kugamba okusala. Tuchikola nyo abatana bakuzala. Yes, nga tanda bakuzala kuba je bali nafuna kansa nga talina yadde omwana omumagwa n'abaana. So when you do that lip no jako, the chances are yes nabanebe omumagwa n'abaana guba gunafi jukira gwe openinga. So they come with abortions bavavamo. But when olusi when you know you have done this procedure on this woman, right to mugamba, once you conceive you come and we tie, we fix, because you will not be able to sustain the heaviness of the baby.
Okay. So you monitor them.
You monitor ngamba olufuna olubuto you come. Olusi wajene tumukebera walo betukebera nga tamanyi nti ali lubuto. Twala bato tamanyi nti ali lubuto tuli mu outreach tukebera. nosanga nti ogundi bukyuse nogamba naye when was your period before you treat olina okusooka okumanya so abo tuba postpone ngamba ojja kusooka kuzaala then you come for treatment. So follow up and depending on what time, so you can cut it out, but you can also remove the whole uterus depending on the stage. Waliwo wokola wojamu n'abaana ng'olaba nti it is not overly spread, it is still confined. She probably has other complications and it is the best treatment kubanga wekatandika okutambula era kata yes. So hysterectomy n'abaana neevaamu. Wetwogera ku hysterectomy era erimu ebika nyinza ogijjamu n'enzijamu ne ovaries zaako n'enzijamu n'ensanjabavu ezeetoolodde. That is also a different type of hysterectomy okujjamu n'abaana. So the treatment per se is complicated. Yes, leave it to the gynecologists. Okay. However, what you should do, screen, vaccinate, take care of your sexual health. Okay. Don't miss that screening and listen to your body. Yes, listen and go and see a gynecologist. Oyinza okuyenga eddagala naye ate kyoyengera nga ate kirala nnyo. Noyongerako ebizibu ebirala. Okay, so basically about the treatment kyensobola okwogera.
My dear one, I don't know if you've picked something from this today, from the topic of today. Personally, I want to also tell you, do you love your life? Obulambo prioritizing, and when they say msawo obulambo bugagga, I think kitegerekeka. The day you go and you're screened of cancer, na yengo wado living the best life of yourself, you will know that you've been doing nothing for your life. So life is yes. Love your life. Omuvubuka aliyeyo. Don't waste your life. Ochali muvubuka muto myaka 2 myaka Saturday you say I will live to enjoy my life. To what extent? What will you gain at the end of enjoying and you have lost? We are burying you. So enjoy your life with the reminder in your head inti binabino kwanga wesa katonda ekitiibwa. Obanga byoko atebuso katonda ekitiibwa nayenga you're enjoying your life, you are on a wrong route. Love your life, take care of yourself. If you are not yet married, abstain. What's wrong with abstaining? Abstain. If you are married, commit to your partner. She has it all. He has it all for you. Because don't wait for the management. Let's go for screening. If you have never gone for screening, better go and screen for obulambo kuberanga bulungi sosuku funa bizibu lwabutawuliriza mubiri gwokyegwogera mbagaliza olunaku olulungi tusinkane olunaku orencha next in the last Tuesday with our doctor. We're going to do Q&A. Just comment on any video eri ku TikTok ewaddemu omusawo wa fono. I'll pick on your question and she will be answering for you to understand and learn again. Bagaiza olunaku olungi temuvaawo. Have a very beautiful day.